Hi everyone, I'm Dr. Varun. I'm a psychiatrist, and today we are going to talk about a very interesting topic, schizophrenia. Schizophrenia is often misunderstood. People feel that schizophrenia means split personality. However, that is not true. Let us try and understand what is schizophrenia, how we can recognize it, and how we can treat it. Schizophrenia is a serious mental health disorder. It affects the way a person feels, thinks, or behaves. Very often, people feel that they have lost touch with reality. This does not occur because of poor background, weakness, or choice of the patient. It's just like any other medical illness, like diabetes or blood pressure. Schizophrenia affects 1 in 100 individuals worldwide. It often begins in late teens or early 20s. For males, it occurs in their early 20s, while for females, it occurs in the late 20s or early 30s. While the exact cause of schizophrenia is not known, it is firmly believed that it arises out of a combination of three main factors. First, genetics. These genes are passed down from generations and are inherited from parents. Second, an imbalance in the brain chemistry. Imbalance in hormones or neurotransmitters such as dopamine, serotonin, and noradrenaline can lead to a disorder like schizophrenia. And third, environmental factors like stressful life events, use of substances, migration, or immigration. Schizophrenia is characterized by three main types of symptoms. First, positive symptoms. Here, things simply get added to the brain, like hallucinations, where the person begins to hear or see things, delusions, or false beliefs. Disorganized behavior and disorganized speech may also be seen. Second, negative symptoms. Like the name suggests, here the brain is lacking certain things. Lack of motivation, poor facial expressions, or social withdrawal. Third, cognitive symptoms. Poor memory or difficulty in concentration is an example of cognitive symptoms. If you know anybody who has these symptoms, please don't ignore them. Early detection matters. The good news is schizophrenia is treatable. The treatment often includes two main parts. First, medications. Use of medicines like antipsychotics helps to reduce the positive symptoms like delusions and hallucinations. A few medicines can also help to improve sleep and cognitive abilities. Second is rehabilitation. Therapy can help people to understand their emotions and learn to express them. Teaching them certain life saving or essential skills can help patients to secure a livelihood for themselves. Family support and counseling of the patient as well as the family members is of utmost importance. Treatment of schizophrenia is a long drawn process, a battle that has to be fought hard and long. Patients with early diagnosis and regular treatment can often have wonderful outcomes. They can live independent lives, have families, and go to work. The earlier we treat it, the better the outcome. If any of your loved ones show signs or symptoms of schizophrenia, please don't delay. Avoid hiding the illness or avoid blaming the patient. Seek the help of a psychiatrist. Early diagnosis and treatment goes a long way in improving the outcomes. Together, we can break the stigma and help all patients live with dignity. So stay informed and be kind towards their mind.